So the purpose of this presentation today is to simply provide information on the Center for Medicare and Medicaid Services, also known as CMS, COVID-19 Vaccine Mandate. And this is based on information as we know today. This mandate requires most healthcare facilities who receive Medicare and Medicaid reimbursement payments to implement policies and procedures to vaccinate all eligible staff against COVID-19. First and foremost, for all of us and for all of you, this is an unprecedented mandate. None of us have experienced a mandate like this before at a level like this, and we'll continue to do all we can to learn and assist on this issue. So this mandate, as I said, is from CMS, the Centers for Medicare and Medicaid Services, not from MNA. And it's not from your employer, although your employer does have a responsibility to comply and create these policies and procedures so that they do comply. CMS is a federal agency under the National Department of the National Department of Health and Human Services that administers Medicare and Medicaid programs in partnership with state governments all across the country. CMS has issued this vaccine mandate. Facilities will comply, and we're seeing that all the facilities across our state are having a plan to comply because they would lose their Medicare and Medicaid reimbursement payments. And this is going to remain this way unless something at a federal level changes. The federal administration has said that it believes it is on firm legal footing even after the federal appeals court ruling, maintaining that it has the authority to mandate vaccinations for workers in an effort to stop the spread of COVID-19. So who does this impact? It impacts all eligible healthcare staff working in these healthcare facilities, including all employees, contracted workers, licensed providers, students, and volunteers. The supremacy or authority of this mandate is it is federal, and it does supersede all Montana laws, including House Bill 702. This informative presentation that we have tonight is not about House Bill 702, only the CMS vaccine mandate. If you do have specific questions about House Bill 702, please email info@mtnurses.org and a staff member will reply. So I do have a brief bullet point document that we will share. Our national affiliate, the American Federation of Teachers, Nurses, and Health Professionals, prepared a bullet point summary, and I'll share this with you soon. And this document is also available right now on our website. So there's a little confusion I want to kind of dive into. I don't know if you all saw the news last night, but there's the Occupational Safety and Health Administration, OSHA, did issue months ago an emergency temporary standard, and it was aimed at protecting unvaccinated workers from the risk of contracting COVID-19 in the workplace. The ETS applied to all private employers with 100 or more employees. However, it did not cover healthcare facilities. So, however, last week at the Fifth Circuit Court of Appeals, plaintiffs filed a temporary stay, national stay on this OSHA emergency temporary standard, also called the ETS. But yesterday, actually last night, the courts upheld this stay request, which prompted OSHA's announcement that it is suspending the enforcement of their rule that does cover other than healthcare facilities. And this decision does not currently impact the implementation of the CMS rule for healthcare workers all across the country or here in Montana. Employer advocates are recommending now still that employers still prepare to comply with the CMS mandate. This situation is obviously, as of last night, it changed on us. It's a fluid situation. And we're going to continue to update our members through email, website, maybe another presentation like this, as we learn of any modifications or changes. And as of today, at least 12 states have filed suit against the CMS mandate, including Montana. And Montana was also involved in the OSHA ETS stay request that was upheld yesterday. So McKenna, you did share your screen. So I'd like to take a couple minutes and go through this document because it really, in a brief bullet point summary, does discuss who this impacts and what needs to be done. So right now, this is requiring most healthcare facilities to receive Medicare and Medicaid reimbursements to implement policies and procedures to vaccinate their staff. Additionally, the one question we've gotten, and I'll address this one now, is weekly testing as an alternative to full vaccination is not permitted under the CMS rule. Okay, I know that's a question that we've been asked a few times. Facilities that are covered are hospital and critical access hospital, psychiatric residential treatment, ambulatory surgical centers, long-term care centers, immediate care, outpatient rehabilitation facilities, home health hospice, rehab centers, home infusion therapy, basically anybody that's doing any kind of, touching patients they're going to be required to receive the vaccine. The dates that you all need to be aware of, and I'm sure you've seen communications from your facilities here, is all eligible staff must have received the first dose of Pfizer or Moderna, or the single dose of Johnson & Johnson by December 5th, 2021 of this year. And the second, and employers must have all the policies and procedures in place by the 4th of January. We are slowly receiving copies of these policies and procedures and taking time to review these. Under the CMS rule, there's a requirement to offer a medical and religious exemption, and I'm going to kind of dive into what we know about these right now in a few minutes. And they also have a temporary delayed vaccine, and this could be if you've had treatment. I know if you've had the Regeneron treatment or if you've had COVID-19 recently, they will delay that vaccination based on a medical reason. But that's going to be an individual-based situation. There are certain employees who won't be covered. These are telehealth staff who provide telehealth 100% of the time. And then they have a few other bullet points who aren't, but as nurses and the nurses that we are working with in our facilities across the state, you are going to be required under this rule to either receive the vaccine or comply with or file a religious or medical exemption to comply with the policies your hospital's putting into place. The last part of this document goes into the OSHA standards, which I think this right now has to be updated based on the ruling from last night. So we can go ahead and move off of this document. Again, it is on our website. So please use that if you have questions, and let your coworkers know that that is on there. We do additionally have a full FAQ on this mandate as well posted on there. So we've been asked what MNA's vaccine position is, and what our position is on this situation is MNA does not have a position on the CMS mandate, but it does recommend nurses, healthcare workers, and the public get vaccinated, and MNA continues to advocate for exemptions for medical and sincerely held religious beliefs where vaccines are required for your job. Back in September, MNA did put out our full vaccine position statement. This occurred after FDA approval, and you can find that on our website as well at www.mtnurses.org. So what options are available for nurses? Right now, as we know, the options you have available to you are you can either receive the vaccine as a job requirement, request and file a declination form based on either a medical or religious exemption, or potentially be required to terminate your current employment. So what do you need to do now? If you've already been vaccinated, you'll need to comply with your facility and provide the requested documentation or follow their specific policy that they've implemented so that they're in compliance by the 4th of January. if you've not been vaccinated, you have to request from your HR departments. And I'm sure most of you have seen communications out from your facilities already. You need to reach out and ask what you need to do to comply, which would be requesting and filing a medical or religious exemption form. And these, the processors are kind of coming out to be, they are different at every facility. And highly recommend don't wait until the deadline, because the deadline for taking action is December 5th, and that is not too far away. For nurses covered by a collective bargaining agreement, our union nurses, your labor department staff is working to make sure we're provided with all the policies and procedures to determine if there's any if there's any need for us to collectively bargain over any effects of this mandate that we find in these policies. As we receive them, so we encourage our collective bargaining nurses, once you see those, make sure you get those to your labor reps. We are, as a group, reviewing these, and we will follow up with local bargaining unit officers if we see something that we determine that would need to demand a bargain over. And we're looking to make sure that these are fair and equitable policies. They are differing. We do believe that the Montana Hospital Association has provided some facilities with a template, a policy template and declination form templates. We haven't seen the template, but we're starting to see some of these policies coming in. What's really important to know is each facility has the ability to approve the medical and religious exemptions. And from conversations I had just as even this morning, they're all doing it differently. So this is going to be very dependent on by facility, differ from facility to facility. We have tried to provide a few minutes for some questions. If you have a question, as McKenna said, please type it in the Q&A, and we will get that answered to the best of our ability. And if we don't know, I will let you know we don't know, and we will get you that answer. And we also, if we run out of time and we haven't gotten to all your questions, we're going to save the Q&A in the chat, and we'll send a follow-up email to the participants that are on here today. We did receive some questions ahead of time, so I'm going to start with these while you're typing in any questions. And the first one I have is what happens if I choose not to comply or do nothing? Actions taken by each facility will differ. As of this morning, we have heard just from 2 facilities on what they're doing, and they're very different. One, if you don't comply by their deadline, they are going to suspend the nurse or employee for 3 days without pay and allow those 3 days for that nurse and employee to make a decision. Another facility is approving up to a 30-day leave of absence without pay and can provide up to 30 days for that employee and nurse to make a decision on how they want to comply. These are going to be different, but one thing we've heard over at least these 2 facilities is that they're not paying when you just make your decision on what you want to do. So again, I'm just encouraging you all to not wait until the last minute. Who has the ability to approve or deny a medical or religious exemption? So from what we know, this process again is being done differently by facilities. One facility I know is approving religious exemptions just by checking the box. Another facility is having the attorneys review them, and at that point, if there's questions, the attorneys will reach out to these employees. So again, this is differing, across the state, and they're just starting to slowly kind of trickle in. Another question is, if I request a religious exemption, will I have to provide documentation of my beliefs? You may be asked to provide documentation, and again, it's differing. But I encourage you to reach out to, if you're covered by a collective bargaining agreement, please reach out to your labor reps or myself. If you're not, please just reach out to the office. We'll do what we can to get these questions answered. And We've never dealt with anything like this other than with the flu vaccine, but this one, because it's coming from such a high level, it is really, again, an unprecedented mandate that is new to us just as well as it's new to you. A big question, will House Bill 702 protect me from having to comply with the CMS mandate? No, it won't. The CMS mandate supersedes the current Montana law. Another question that we've seen now on three policies is if I'm granted a religious exemption, can I be reassigned? We've seen this on 3 exemption forms so far. What we've learned, and we're continuing to do further investigation on this, but we believe the law does allow for reassignment. And I think they're following the law by doing that. McKenna, do you have any questions? Other additional questions?
I do, yes. So I got a question in the chat here that asked, is the CMS mandate required for community health centers?
That's a good question. I would have to look into it. It's not specifically bulleted out on anything I've seen. Vicki, do you know?
Sorry, just trying to get myself off mute. My understanding is yes, but we will verify that and make sure that's on our frequently asked questions because it does touch patients as well as a community health center.
Right. And if they receive Medicare, Medicaid funding, I would think then certainly yes, because this is
required.
Right.
That was a good question.
Another question about where and in which facilities this mandate applies. Would it affect privately owned clinics?
Yes, if they're receiving Medicare and Medicaid reimbursement payments, yes. From what I've seen, there isn't like a threshold of a number of employees. So yes, the basis of this mandate is based on the Medicare and Medicaid reimbursements.
Great. Any other questions from the group? Please put them in the Q&A and we can keep reading them off. We've done a really good time we've done great with our time management. About school nursing staff. That's another question about who must comply. School nursing staff.
That is a good question. Again, it's not in the bullet. I don't know how those programs are funded, but we can definitely get that answer for you because it wasn't required of, yeah, that's a good question. I don't know the answer to that. So I'm going to jot it down and we'll find out. I don't know if school programs are funded through Medicare and Medicaid. I don't know how they're funded, so I'll have to find out.
Yeah, we're getting plenty of questions about the breadth of the applicability of this mandate. So the next is about either chiropractic or PT offices. Do we have any knowledge on that front? And of course, Nurses Union and the Nurses Association, we typically will try and figure out what might apply to you, but do we have any knowledge at this point in time, Robin, about a PT clinic or a chiropractic?
If they're receiving Medicare and Medicaid, yes, they would. And I think that the bullet from rehabilitation centers, outpatient rehabilitation facilities, yes, especially because I do know that some of those do receive Medicare and Medicaid payments. So yes, they would need to comply.
Excellent, thank you, Robin. There's a question about reassignment, because in your presentation, you noted that it would be within your employer's discretion to set up a reassignment if the nurse filed for a religious or medical exemption. If a reassignment happened, could it involve a position where you don't provide direct patient care?
What I know about this today, and I will dig into it deeper, and in all honesty, it was yesterday, Amy had sent me an email from a facility that had this on only their religious exemption form, not the medical exemption form. However, under the law, under the American with Disabilities Act, and under your Equal Employment Opportunity Commission or Occupational Commission, the EEOC, both of these agencies, because your employer has the right and the ability to provide an accommodation, but they get to determine what that accommodation is, because it can't be an undue hardship for them to fulfill the needs that they need to do to run their business. And under the ADA, it clearly says reassignment to a vacant position is a form of a reasonable accommodation. I did read that there can't be like bumping of nurses. And that also under the EEOC, it states reassignment is reasonable accommodation as a last resort. But it's a good question on if it can be reassigned to not providing patient care. And I don't quote me on this, but I would say potentially, because maybe there's a time where there's chart reviews being done, or something outside of direct patient care, but still, you are more than qualified to complete. That could potentially happen.
Right. Thank you, Robin. There's a question here a good question from Gwen Palchek that says, since there have been so many lawsuit consolidations and this OSHA ETS ruling has been suspended, are MT hospitals going forth with implementing the ruling? I think I could go ahead and answer this one, that as of today, yes. And that could very well change if there are changes in the legal world, if that makes sense. So as of today, yes, Montana hospitals are all going forth with compliance and setting up their declination forms, and still working toward that December 5th deadline until the situation might change in the legal sphere.
And it would have to change on the federal level.
There's another question about a little bit broad, but can you speak to why some hospitals are approving exemptions and others are not?
That is a very good question. I don't have a good answer for that. Just even this morning, I don't know why one would choose to use an attorney to review something and one would not. I think, honestly, in just my opinion, I think there's going to be facilities that we potentially see that might be more liberal on approving exemptions with this mandate. And I do think some might be more not liberal on approving these. Our labor department, McKenna and Amy and Leslie and I, and talking with Vicki, we've sat down and talked about what are we going to do as a staff if we get 250 grievances over this, or how can we help nurses kind of navigate this mandate, because it's coming from so high above us. This is a federal mandate. We do have the ability to, like I said, review and make sure these policies and procedures make sense and they're fair and equitable. We don't have the ability to tell them how to approve them, but we do have the ability to question if, say, McKenna receives a religious exemption and Robin did not, what process did McKenna, how was that done? And we can ask those questions and make sure that the processes are being done fairly and equitably across the board.
Great, thank you, Robin. Okay, any other questions from the group here? Okay, we've got a couple of questions here. One is about the nursing shortage that we're already experiencing. There's a question about if there's a plan for addressing the nursing shortage, and are we nervous? I think a lot of people are nervous, but are we aware of any state-related plan or organizational plans that we could share?
Vicki, I'll defer. Yes, we're nervous. We're very aware of the nursing service shortage, and I'll say one thing and kind of segue to Vicki. But Vicki has been adamant and advocating for how to address the shortage here in Montana and how to invest in the nurses here in Montana. There are federal funds available. We are continually asking to have a seat at the table to discuss these issues. And everything that Vicki has put out or requested is available on our website. I highly recommend take some time and go through those documents. And Vicki, I'll turn it over to you. I think you were talking about this with somebody today.
Yep, and that would be a total other webinar, as you know, it's certainly the mandate can impact the staffing, but we are gathering the information. I've heard from many nurses across the state before this mandate even come down, because as you all know, we've been battling a nurse shortage. And with that said, MNA has been advocating for our current administration to invest funds, whether they're ARPA funds or whatever funds that are available, invest it in the nurses that are here now on the ground, working every day, not invest it out of state. We've got to keep who we've got, or do we do a little bit of both? But we haven't had a seat at the table. We've asked for a seat at the table, and we hope to have a seat at the table so we can talk about how we can get that taken care of. Thanks for the question.
Thank you, Vicki. Okay, and then a question from, well, this is a great question we can reference now. If a nurse has filed an exemption and that exemption has been denied, what would be their next step?
I would have them, if they're have an issue, I would have them call their labor rep just to make sure that we can verify that the process for that decision was done fairly and equitably. Amy, thank you. You can file a claim with the Human Rights Board. Again, this is a federal mandate. It's tied to Medicare and Medicaid reimbursements. I'm not sure if that claim would go anywhere. This is something all of us have never seen before. So you're navigating it as we are. But first step, I would make sure you reach out to your labor rep. If you're not represented by a collective bargaining agreement, reach out to MNA. We can help you draft something to make sure that they provide you with how that decision was made. And again, they're all, from what I'm just learned of, I'm gathering a little bit more information each day that these processes are definitely differing. 2 facilities have told me that they're probably going to be fairly liberal on this. And so
Robin, if you can close, and then we can capture the questions and continue those on info.com.
Oh, it's 4:30.
Good. Yep.
Yep. So I thank you for attending this. Again, we're going to keep you all abreast of things as we learn. If you please check your email and please check our website. We will be posting information as we learn about this on there. Again, this is a recorded session, so we will make a link available for anybody who wasn't able to be here. So let your coworkers know. If they wanted this information, they can just download or watch our link. McKenna's also shared all these documents in our chat, and they're also all available on our website. Don't forget to reach out to your labor reps. Make sure everybody at MNA gets these policies and procedures so we can take a look at them too. And we appreciate all you do, and thank you for your time today.